Hi, this is Dr. Evan Oster with Massage Therapy Insider. Welcome to video 3 on helping your clients with low back pain. In the first video, we looked at the myths of low back pain. Both the tightness causes low back pain, and we saw reality. Stabilization is the reason why clients, the loss of stability is why clients have low back pain and get tight. The tightness is trying to create more stability. Video 2, we said and showed how do we myofascially release the client to allow better alignment of the thorax over top the lumbar spine, over top the pelvis, to create better connection through that thoraco-pelvic canister, because we want the thorax lined up, the rib cage coming down and feed right into the pelvis and lower extremities. So we create a better alignment so we can better activate the abdominal wall. Because again, once clients get off our table, if we don't teach them a new strategy, they're going back to their old movement strategy. So we want to teach them a new movement strategy and teach them how to engage these abdominal muscles to better support their low back, both to help them decrease pain as well as improve their posture and their movements. So again, this is an integral part of the integrated movement system, and we have to teach our clients a new pattern so they do not go back to their default, which is bracing back up or tightening back up for stability. So I want to show you why breath and how breath can help us establish better stabilization and alignment in our clients. So I'm going to have Ellen demonstrate a bad breath that many of our clients do, or bad respiratory pattern. So I'm going to zoom in here to Ellen's rib cage. And Ellen's going to take a real deep breath in, and here, stop just for a second, here you can see the flared rib cage, the abdominal almost hollowing that happens, and the upper airway type breathing. So relax and breathe out. And then do the same thing again, Ellen. You see the rib cage widen and flare, and the chest rise, and all the breath comes this direction. So we want, relax and breathe out. We want Ellen to be able to breathe down here, real low, like down by her ASISs. We want her to breathe wide, lateral, into her lower back and posteriorly. So we want the rib cage to expand posteriorly to, again, fill up the entire abdominal cavity, as well as to allow the diaphragm to drop down so we get better and more optimal stabilization through the entire low back. So again, I'm going to put my hands on Ellen's rib cage to encourage her to breathe wide, and zoom in on my hands so you can see my hands expanding. So take a deep breath in as Ellen goes laterally and fills up this entire region here, and then breathe out. And I want her to drop that rib cage down as she breathes out. Many of our clients cannot get the diaphragm to come down as they breathe out, so they stay up in this high inspiratory position. We want the rib cage to come down, the diaphragm to come down when they breathe in, and then go up as they breathe out, but without bringing the rib cage with it. I'm going to stick my fingers here, zoom in on my fingers now, breathe into my fingers, Ellen, and you see my fingers expand out of her abdomen as the diaphragm pushes down and pushes the abdominal contents down towards the pelvic floor. The pelvic floor then contracts back against that. So we want the diaphragm dropping down as she breathes in and coming back up, but without bringing the rib cage up with it as she breathes. So one more time, Ellen, breathe in, low, perfect. She breathes wide and into her low back all at the same time. And then relax. We'll do one more. You can see Ellen's rib cage is starting to come down and stay nice and smooth, so we have a nice contour through her abdominal wall. One more time, deep breath in, and you see all this expand all the way through here, through her entire abdomen region. Okay. Now I'm just going to have Ellen coordinate activation and breathing. I'm going to have my fingers here. I'm going to have Ellen resist me pushing my fingers in to activate the deep abdominal wall. I want to make sure I also cannot push my fingers into her lateral wall, so I get the lateral wall activation. Now she's going to continue to breathe as she stays activated. Again, you see the nice alignment, nice smooth contour of the abdominal wall. And she gets nice three-dimension expansion of the entire rib cage and abdominal wall while she has stabilization. And that's the key to stabilizing the low back. Three-dimensional breathing with activation of the abdominal wall without gripping. I'm going to have her show you a dysfunctional pattern. Pull the belly button in, suck in real tight. You see the rib cage go up, suck in. You see her start to hollow through here. That's a dysfunctional abdominal strategy, stabilization pattern, and it'll create more low back pain. We want the rib cage to come down, her to relax the abdominal wall, but activate three-dimensionally, and you see that nice smooth contour that tells us we have control all the way around her low back. So again, the key, get her myofascially released so she can align her thorax over top her low back and pelvis. Teach her how to breathe three-dimensionally so that she can stabilize and use a diaphragm to stabilize her low back. Third part, teach her how to activate the abdominal wall, the deep abdominal wall, coordinate it with respiration, so three-dimensionally, as well as integrity of the abdominal wall. So now we have nice control of the thorax over top of the pelvis, and now she can start to get long without having to grip, strain, brace herself into that posture, and that will help a lot of your clients with low back pain. I hope these videos served you. If you found them useful and helpful, please share them with your friends. This is Dr. Evan Osar with Massage Therapy Insider. Please check out our free videos on our site and our information. We'll catch you next time. Have a great day. Hi, this is Dr. Evan Osar, developer of the Integrative Movement System and founder of Massage Therapy Insider. I hope you enjoyed these videos because one of the challenges of being a massage therapist and one of the great opportunities is we have lots of clients that have low back pain, and we have lots of information that are out there about low back pain and how to treat clients with low back pain. So it creates, again, a challenge because there's a lot of conflicting information, and an opportunity because there's so much opportunity to serve clients and be part of the solution of our healthcare crisis. And low back pain is a big part of our healthcare crisis because so many people experience low back pain. As I said in the first video, one of the challenges and opportunities we have is to become a specialist and specialize in something rather than become something to everybody, to be a jack of all trades, so to speak. Again, that's good when you're first beginning, but as you get yourself developed, as you develop yourself into an expert, clients want to know that you are that expert that they can come to when they have distinct and specific problems. They don't want to come to a generalist that treats everything, ankles, knees, pre and postnatal, pre and post surgery, athletes. They want to know if they have low back pain and they want to work out that you are a specialist in dealing with low back pain and they can come to you to help them solve their problem. So you become a problem solver for your clients with low back pain. These videos were a start of that process of both educating and how and why clients have low back pain, how to develop a strategy to get them out of some of that back pain, and then teach them one of the biggest reasons why people have pain and dysfunction anywhere in their body isn't because they're too tight, isn't because they don't stretch enough, isn't because they have these postural syndromes. That all adds to it, but they have problems because they have problems stabilizing. The integrated movement system is a way to teach and help your clients become more stable so they can move better when they leave your session. The work you do is so important as a massage therapist, but you also, part of that work is also to help them develop a strategy to leave your office with. How do I live my life better in my body now that you've got me into a good place on the table? And that's what we try to teach you, and that's what we strive to teach you in both our Massage Therapy Insider newsletter and in our workshops. If you found this information useful and you want to learn more, you want to see how to put all this information together, please join us in October for our low back seminar on release, reactivate, reintegrate. I'll show you how to assess a client, how to myofascially release them, then how to reintegrate their system so when they leave your table they are more stable and they can live their lives in a more stable position, and you can develop yourself as the expert that the industry needs, and more importantly that your clients need. So you get paid as an expert, you become the expert, and you build your business because of your expertise. Again, I hope you enjoyed these videos. Feel free to watch them again, review the information. Please join us in October if you're available, and let us help you become that specialist your clients need and want. Have a great day.